Hello, my name is Ingrid Walker-Descartes. I am a boarded pediatrician here at Maimonides Infants and Children's Hospital of Brooklyn. I'm also currently the program director as well as a child abuse specialist here at Maimonides. So my medical training, I went to medical school at University of Rochester School of Medicine, upstate New York. So after University of Rochester, usually our training is about 4 years. I actually took a year out, and I'm originally from the Caribbean. I'm from Jamaica, so I went back to the Caribbean and did some field work where I gave, free health care with an organization, and then came back and finished up medical school. So after I finished medical school at Rochester, I did my Pediatric Residency training locally in Brooklyn at Methodist Hospital. As immigrants, when my family came from Jamaica, we settled in Brooklyn. And I really wanted my training to be with families that was similar to the background as mine. So I came back and did my training in Brooklyn. After that, I decided that I was happy doing general pediatrics, but there was a lot of trauma in terms of child abuse and maltreatment. And so I actually did a general academic pediatric fellowship at Mount Sinai Hospital, which also overlapped with child abuse. So our clinical time was split between pediatrics and child abuse. And so after that training, I then came to Maimonides and have been really happy since being able to do both and juggle both. My specialty is children. I chose to be a general pediatrician because really all aspects of family and children and what it requires to grow them and grow them so that they are functional and effective adults really interest me. I had a little bit of difficult time settling on what aspect because I really thought about mental health as well and thought about maybe I could go into child psychiatry or something like that. And had a really lengthy discussion with a child psychiatrist who said, you know what? The best mental health care comes from a primary care provider. So I really enjoy just all of pediatrics. I enjoy from delivery to adolescence. I enjoy all of it. So I say being a really general in my interest is where it remains. And that way I just never, ever, ever get enough. I think each and every encounter that I have that I come across patients and their families, I learned so much in just the way they look at things, the way they see things. No matter how sad things are, they're still able to play. No matter how, sometimes in my trauma work, no matter how harshly they're treated, they're willing to forgive. So I think I'm very happy to have happened upon a field where actually your work keeps you fueled. And that's pretty much what makes me so interested in kids. They can just keep on living despite anything. My treatment philosophy is really just, giving quality care to everybody. I think a lot of times when patients walk into the office and I want to hear what they have to say, and I talk to everybody, even if it's the 2-year-old or the 4-year-old. As I say, I have kids of my own, so I can discuss politics to Dora. It doesn't matter. And I just include everybody in the visit. Because at the end of the day, we want specific things for our families and our kids. I think we should just give that across the board, meaning that each child is a part of somebody else's family. So we'll say, oh, I wouldn't even send my mother or my father to that person. I don't think it has to be, everybody is a part of someone's family. So that being said, you give quality care to everyone that walks through the door. So if anything happens at the end of the day, you really know you tried your best, and that's equal. This interaction I had with a young man was during my medical school years. I actually met him in a foster care clinic when he was 3 and kept in touch with the family, followed him through adoption. Actually, been in touch such that he's gone on family trips with my family. He's now 20, in college, doing his thing. And this was a kid who would come into the foster care clinic every week with stomach aches. And the doctor at the time said to me, you know, whenever I was actually a volunteer to read in the foster care clinic waiting room. That's how I met him. And we would talk and so on. And she said, usually once he comes back to me, the stomach ache is gone. And she said, you know, a lot of these kids, they have somatic complaints that has nothing to do with anything medical. But if you show them the right attention and the right support, and she really encouraged me to really meet this family because she thinks my bond with this young man would be helpful. And to this day, we talk monthly. And, you know, yeah, he's made some mistakes, but all in all, he's done a wonderful job considering where I met him when I met him at the foster care clinic. So I will always remember him. And I have 2 children of my own, and you know, he always says to me, "Am I your only son?" And I said, "Yes, you are." And he is my only son.